Time to say goodbye on Sam O'Neill's own terms.
She wanted to live, but she was told, "You're terminal. There's nothing more that we can do for you."
Her dying wish to spend those precious final moments surrounded by family. Instead, Sam's parents say those last hours were filled with trauma and pain.
It was really, really hard. Like, you watch her writhing and moaning in pain, not conscious, and she's not going to be conscious ever again.
The 34-year-old ravaged by cancer chose medical assistance in dying, or MAID, but on April 4th last year was forced to transfer out of St. Paul's Hospital, where the procedure isn't offered due to faith-based policies. Samantha was transported to St. John Hospice, also operated by Providence Health Care, where MAID is allowed.
The doctors know this is going to hurt. It's going to hurt so bad. It's not just a bump. It's going to hurt so bad we have to fully sedate you.
Gay and Jim O'Neill and a local palliative care doctor are now taking legal action against Providence Health Care and the provincial government, claiming Sam did not choose to go to St. Paul's Hospital, a publicly funded facility operated by a faith-based organization. They allege violated several of her charter rights, including freedom of religion and personal security, adding its policies subjected her to severely increased suffering, and she spent her last hours unable to see, hear, or feel any of the people who had gathered to support her.
Providence Health Care and the province of BC overstepped their bounds because they knowingly, unjustifiably hurt Sam.
Providence Health Care reaffirms MAID is not available at its facilities as a Catholic healthcare provider, but does partner with Vancouver Coastal Health. And if there are issues or concerns with transfers, the two organizations work to improve the transfer processes wherever possible.
With respect, for example, to St. Paul's Hospital, we are offering adjacent to the hospital, essentially on site. Vancouver Coastal Health will be is organizing and building that. Hospice care, end-of-life care.
It's just wrong. They hurt her on purpose. They could have let her die in that room and made comfortable.
Sedated multiple times due to the transfer, Sam never regained consciousness at St. John Hospice, and therefore did not provide final consent prior to the procedure.
Everything was just cut down to a few minutes, and then I got to say goodbye to her on a commode. And I did get to tell her that I loved her.
They say their final precious moments with Sam were stolen, replaced with memories of their daughter's undignified death that will haunt them for the rest of their lives.
Every minute, every second of every day.
John Hua, Global News.